Dr. Quinn, this is a transition that many women are concerned about. Tell us about this. You had a patient earlier complaining of some of the symptoms that helped you reach her diagnosis. What happened?
Well, basically, just to talk about that patient, I've had so many patients over the last 19 years as a family doctor reach that transitionary phase, and this is for the ladies. Normally, it occurs in women in their 40s. It can occur in the late 30s, and it can occur in the 50s, but normally in their 40s. And basically, the patients will come in and complain about symptoms such as missing a period, which leads me to this one patient in particular. She thought that she was getting ready to have another baby. She had just remarried and her daughter was in college. She was like, no. But anyway, we did a pregnancy test and it was negative, although you can become pregnant when you're in perimenopause, which is the time before you hit menopause, where you start missing your period because your ovaries, less of the hormones are being made to include the estrogen. But also, it's just a time that women have to understand we can transition on into menopause, but it occurs when you've not had a cycle for 12 consecutive months.
Interesting. So, how can a patient be affected by this?
Well, there are a lot of signs and symptoms. And ironically, today, as I was saying just a few minutes ago, I walked in an exam room and a patient showed me this. This is an over-the-counter supplement. It's an estrogen supplement. And what it does is it helps to make up for some of the decrease in the estrogen that a person is experiencing, which is very helpful. But this decrease in estrogen causes symptoms to include some women get a little moody. They can be depressed, anxiety, maybe hollering at the husband a little bit extra. You can have vaginal dryness, having problem with relations with your spouse. Other problems could include fatigue and so on. And so we have to understand that it's a transitional period and it will get better.
Okay, all right. So this is something definitely folks around, you said late 30s and 40s, should certainly be aware of. And how else can these women be treated going through this transition?
Right. Well, as I said, if it's really severe and you're getting those severe symptoms, go visit your doctor. In a lot of cases, the doctors will do some form of hormone replacement. Some will even do low-dose birth control pills because you still can get pregnant during your perimenopausal cycle, although it's less. And then lastly, I read a lot of literature about just getting in better physical shape. It helps a lot, getting to a better weight. And then some women might take medicine to help them with the mood swings, maybe an SSRI like a Zoloft or a Prozac. But at the end of the day, no, it will get better.
Okay, good to know. Who knew there was a phase before menopause? Never thought about that. Very insightful, Dr. Quinn.